Good day, mate. As you can see, I'm a bird sitting on a fence. They call me Jay. I'm really interested in checking out your RPD framework design. Let's look at some framework designs with suggestions for possible improvement. Some of the other birds and I will be looking at a few designs. You're welcome to look too. We'll give these things a grade, of course. A is good, and F is bad. Okay, here's our first one, a Kennedy Class 1 design.
Jay, why on earth does this guy want a partial?
Don't know, mate, but he does. What do you guys think?
Well, the first thing that strikes me is that the bases don't look like they extend to cover the tuberosity.
Right. I thought you wanted to cover the tuberosity with the base. If there is insufficient space for acrylic, the metal could be extended.
It looks like at most we're gonna replace 3 teeth. Let's just extend the bases to cover the tuberosities. Okay, what about the major connector?
It's possible that it could assume a little more of a U-shape. But I like the texturing. It's supposed to feel more natural. The three-dimensional curvature increases its rigidity.
I agree, Jay, but why don't we leave it? It's not all that bad.
Okay.
Yeah, I see what you're saying. Nowhere close to the vibrating line. It could be a little shorter and less likely to gag the patient. Okay, this is totally arbitrary, but maybe the guy's a gagger. You had another observation about the bases?
Normally the extension base partial would have a ladder. In this case we can assume the patient has been missing teeth for a long time and we don't anticipate much bone resorption.
Right. Plus, there could be limited interarch space.
Okay, so you guys are okay with metal bases. Now what about the rest placement?
The distal rest on 12 is a mystery to me. Why not put it on the mesial, and remove the plating? Jolly well.
Agreed.
You birds are right about that. Let's move the rest to the mesial.
I would use cast round clasps on both the abutments.
Splendid. But wrought wire is acceptable here. The cast round has excellent flexural characteristics and may be better adapted to the tooth, and does not have the laboratory process associated with the wrought wire. The palatal plate acts as a third rest and limits rocking of the partial.
And if you look closely, the wrought wire is not well adapted to tooth number 4. That's a failure to correct the contour of the axial surface.
Should have caught that sooner. But it's still possible to correct this defect. Another advantage of wrought wire. So, we'll leave the wrought wire? And remove the plating. I don't know, but if the plate isn't perfect, it can move our fulcrum line. It's also a little more hygienic not to plate.
Well, what about the anterior plating?
You know, I hate to admit it, but sometimes it become a little matter of personal bias. I really don't like invading the tongue space with a plate. But in this case, I can see the plate providing some resistance to rotation in the horizontal plane, plus extra indirect retention. Looks a bit bulky.
Agreed. But I think we would all agree that the indirect retention is good.
That's right.
Yes, maxed out. And the reciprocation?
Looks adequate.
Yes, the clasps are reciprocated with the mesial bar and distal proximal plate.
Okay, how about a grade? Here's the original design. I don't think this one passes.
I say F.
Absolutely, F.
You know, covering the tuberosity is such a basic thing. I'd give it an F also.
Okay, and a big fat F at that. Okay, the next one is a mandibular Kennedy Class 1.
Now, I can see why this guy needs a partial. Not a lot of tooth support. Got a lone standing abutment. Needs a bridge there.
Let's just assume the patient can't afford a bridge. We're left with a modification space. Let's start with the major connector.
Not much argument there. A lingual plate seems to be our only option.
Yep. Sure looks like it.
Okay, what about the bases?
Like the last case, the default option here is the acrylic base retained by a ladder. However, The alveolar bone probably has resorbed and we can use a metal base, which is more hygienic.
Yeah, but I don't think it's long enough. The bead-retained acrylic should cover the at least 2/3 of the retromolar pad. You know, if the patient can't tolerate it that far back, it's a lot easier to cut it back.
Right. Jay, can we extend the metal a little to support the acrylic?
Okay, let's do that. A little arbitrary, but why not? Let's outline the acrylic base. Now, how about rest placement?
Well, I think we can assume rest seat preparation on the lingual of the anterior teeth. Ledges most likely, since the mandibular teeth aren't noted for their robust cingula.
Yes, I think you're right, although we can't really tell. But why the distal rest on the premolar? Just because it's already there doesn't mean we have to use it.
Amen to that. Although we are really concerned about the patient's existing partial, we're not locked into duplicating it.
You're right, Tom. Let's get rid of the distal rest on number 20.
And who wants to wax and process a tooth on number 21, when a press-fit flangeless tooth can be placed?
Well, you've got to get the shade right, and the occlusion could be tricky, but a whole lot easier.
I vote for a press-fit tooth. We can adjust the occlusion at the framework try-in appointment. Now about the clasping.
Now that we've removed the distal rest, I like the cast clasp engaging the distal of the premolar, and the wrought wire on 22.
Let's look at the fulcrum line. Wrought wire is a definite for the cuspid, but it bothers me that there's no retention on the right segment.
Granted, mandibular incisors are not the greatest abutments.
Well, how about a small cast clasp that engages just the distal half of the tooth, and provides only frictional resistance?
I really like that idea.
So do I. Let's put a small clasp on the distal, but it will only provide frictional resistance to displacement. No undercut.
You know, making a conscious decision to clasp anterior to the fulcrum, and understanding the benefits and risks.
Yes, and we could remove this clasp if we decided it wasn't helpful. And once again, indirect retention is maximized, assuming the lingual plate has rests on either end.
All the clasps are well reciprocated with plating.
Okay, how about the grade? I see everyone shaking their head. Another big fat F. Alright, what about this one? A class 2 mod 1.
Now I like that design. He's got the base properly extended.
Major connector looks good.
Yes. I like the way it crosses the midline. It's wide enough to resist flexor, and it's got nice finish lines for the acrylic.
Let's see the fulcrum line. Okay, good. He's also got the rests in a good place. The anterior abutment on the tooth-supported side has a wrought wire, and the clasp on the distal abutment is cast.
Well, how about the extension base side? With the mesial rest, he could have used a bar or circumferential round cast clasp.
Yes, I probably would have used a cast clasp here, but there's really nothing wrong with the wrought wire.
The reciprocal elements are really nice, they appear to be positioned in the middle 1/3.
Right. And indirect retention provided by the rest on number 5 looks good. I'd say this was a pretty good design.
Right, well. A? A minus?
I'd give him an A.
Any objections? Okay, A it is. This is Jay Bird, thanking you for joining us on the Dental Learning Center. There's lots of other videos featuring superstars such as Junior Poser, the dental genius Homagoon, and his fellow know-it-all, Buster Bedcheck. See you next time.